Last year we carried out field work to publish case studies on the discriminatory nature of corruption on women, girls and specific groups at risk of discrimination. And we did this using the case studies of health and education. The one on health specifically was investigating the challenges that people living with HIV, particularly the key populations in that group, are facing with accessing antiretroviral therapy. In the research outreach that we did, we found that key populations were being charged with fake or supplementary charges to access healthcare and also the antiretroviral therapy. There's a suggestion that some of these, the stocks of these therapies are being diverted at the point of service delivery, where some health workers are now delivering a parallel process of delivering antiretroviral therapy. And there's also some rough treatment of these key populations where they feel stigmatized at the point of service delivery, particularly in public health facilities. So some of them, to be able to cope with this challenge, some of them were giving testimony that they have to go and register at in a different district under a different name to be able to access this antiretroviral therapy. So they've got various coping mechanisms that they are using to continue receiving care, but that's one of the challenges that we noted in the focus group discussions. I think we need to deal with stigma. In this day and age, it means that the stigmatization of some groups of people living with HIV and AIDS is continuing. So that is the starting point. Well, let's do away with the stigma. The programs to assist people with ART, there's a national program of leaving no one behind, and they're supposed to be free. But if some people are taking the opportunity to perpetrate acts of corruption and make money from it, I think that is bad. So let's put proper safeguarding mechanisms at facility level so people can report these corrupt cases. Let's also protect whistleblowers at facility level so people can report if they are being charged these fake or supplementary charges. If they know that some of these drugs are being diverted, they are able to make reports. There are so many things I think that can be done, but I think ultimately let's try and deal with the issue of stigmatization of some vulnerable groups. Well, they mentioned a consultation fee upon arriving at the facility. So they are charged a consultation fee. Sometimes they have to pay a bribe to jump the queue. Some of them want to remain anonymous, so they are put under pressure to pay to be saved quickly, then they leave the facility. Basically, as I say, some of these people are, they shout out the people's conditions in a public space. And yet we are supposed to guarantee people's anonymity. So these are some of the conditions under which this kind of corrupt acts occur, that people then have to pay a bribe to be saved quickly. So these are some of the testimonies that we had in the focus group discussions. Well, I think the immediate impact of the stigma is that people may end up defaulting on their regime, and that negatively impacts on their health. If people feel that they are stigmatized at the point of service delivery, they may also not want to visit these health facilities again, which is not good for their health. But I think ultimately it's important if people are now finding other coping mechanisms to find other alternatives of getting drugs. It may distort the planning for such kind of health initiatives. And I think it also pulls back on progress of those well-intentioned programs to leave no one behind. So that corruption has to be addressed.